When checking for diastasis, it's more important to check for depth than it is width, because this tells us how those transverse abdominals, the deepest layer of abdominal muscles, are connecting and firing. So let's take a look at how to get this level of abdominals to fire and how to check for it to see if it's firing. So join me down on your back. I want you to place a hand on your abdomen. I want you to find wherever your diastasis feels the worst. So whether that's right above your belly button, halfway between your rib cage, or halfway below. And I want you to place your fingers here. You're gonna place your fingers widthwise in the spot, and I want you to inhale, exhale, and just see how you feel here breathing. So what happens? Does anything change with your inhale and exhale? So I want you to monitor that. Then once we get your resting position, I want you to lift your head, just barely. You're just lifting your head. You're not doing a full-on crunch here. And I want you to feel what happens. Did that diastasis get bigger? Did it get smaller? Did you firm up that depth? So how far in can your finger go? Does it go to the first knuckle? Does it go to the second knuckle? Do you feel like you can touch your spine? Okay, all of these things are normal reports that I get from patients, and so it's not abnormal to feel like, I feel all my organs, this feels weird. All right, so go ahead and lift your head. If you feel like you're really sinking down and in, that's something we're gonna wanna work on. So even if your diastasis is fairly narrow, but you're really sinking in, I treat that as a sign that things are not quite firing like they should in your system, and that's something we wanna address, because it could potentially lead to future problems. So I like to get the body working as absolutely as well as it possibly can. So from here, I want you to think about inhaling, and I want you to place a hand under your low back and place a hand on your belly. So inhale, feel your inhale fill into your low back and feel it fill into your belly. Exhale, gently lift your pelvic floor. Okay, so an inhale into your low back should inhale into the back of your pelvic floor. And this is where more women that I see have tightness, and they tend to have looseness at the front and tightness in the back. So we want to make sure that we're not doing all belly breathing, because that doesn't address tightness in the back of the pelvic floor. So inhale, feel your hand expand down toward the floor from your low back. Exhale, gently lift your pelvic floor. So let's use that technique to go back and check depth. So inhale, go ahead and lift your head for me. Exhale, gently lift your pelvic floor. What happens to your diastasis now? Do you feel any firmness happening in that diastasis when you gently lift your pelvic floor? Did that change anything at all? Okay, so to get those TAs to fire, I want you to think about gently lifting your pelvic floor, because our transverse abdominals work with our pelvic floor. So if you find your ASIS, those front hip bones, you gently let your fingers dip right inside of them, and then I want you to lift your pelvic floor. Did you feel anything change underneath your fingers? Did you feel anything firm up or connect? Did you feel it happen more on one side than the other? That might be telling us a story about your pelvic floor. So how your abdominal wall is firing might not have anything to do with your abdominal wall, but how your pelvic floor is leading the way. Okay, so the pelvic floor needs to be a leader for this. The abdominals fire after the pelvic floor. All right, so now give me that big inhale. Feel it expand into your back and into your lower belly. Exhale, gently lift your pelvic floor. What do you feel underneath your fingers now as we add that gentle exhale and gentle pelvic floor lift? Did you feel any firmness? All right, did things start to connect and start to fire? So that's how we're gonna approach this. Tapping into those TAs is very subtly. So sometimes women will explain it as they feel like their hip bones are kind of gently pulling together. Sometimes they'll feel like their belly button is kind of drawing up toward their head, not in. So I want you to work on drawing your belly button up more than in. This is going to help you connect your pelvic floor more. And so focus on this. So see if you can put these together. So that nice deep inhale, feeling your inhale go into your belly, go into your lower back. Exhale, gently lift your pelvic floor. And if you want, you can lift your head. Now, how did that change after a couple of those? Did you feel any tension now? Are you able to maybe sink down halfway to the second knuckle, if you made it all the way to the second knuckle, did that help you generate any tension in that linea alba when you engaged your pelvic floor? Did you feel like you couldn't engage your pelvic floor? Did it feel like maybe your pelvic floor was tight? Because sometimes when you have tightness, you feel like you can't get a good contraction. So you need to first deal with the tightness in the pelvic floor so that we can get that inhale to give our pelvic floor some nice length, so we can get that contraction so that our pelvic floor can lead the way, so then that can help our TAs get on board. So if you have that lower ab pooch, it might be due to the responsiveness of your pelvic floor, not necessarily your abs. So lots of fun things to look at for making your body feel better and work better and connecting to decrease the depth of that linea alba, the depth of that diastasis, and help with connecting your system on a deeper level.